Welcome to Tea Time. I'm Dr. KC, and I'm joined today by Dr. Liana Sved, who is a wonderful physical therapist. Dr. Liana is the founder of Revive Physical Therapy, and she's a doctor of physical therapy who specializes in treating people with head, neck, face, and jaw pain. And she works very collaboratively with other healthcare providers to really support her patients, their best outcomes, and alleviate symptoms. She also works with individuals both virtually and in person in her office in Stonington, and she keeps an active lifestyle with her husband and their dogs. So Dr. Liana, thank you for taking the time to join for tea time today and chat with me.
Thank you for having me, Casey.
Yeah, it's great to have you here. So let's get into talking about all of your expertise. To start with, can you just share a little bit more about what you do as a physical therapist? Because a lot of people are familiar with the term physical therapy, but may not know exactly what that process is like if they haven't been to physical therapy. Could you just share a little around that?
Yeah. So physical therapy, as a physical therapist, we work on the muscles and how they coordinate together to provide the best support for your bony structures, your bones, your spine. And that also includes your face. Your face is a ton of muscles. The jaw joints are supported by a lot of muscles. So that is what I do as part of my specialty. So I've just kind of carried that on to the face joints.
Yeah. And it's awesome that you can work with people both virtually and in person. I think that's really amazing. So let's talk a little bit more about your expertise in addressing what you just mentioned. And I know TMJ, the TMJ disorder, a lot of people have heard that term. A lot of people kind of identify with that term, even if they haven't been necessarily diagnosed as having that. But then also the other like head, neck, face, all of those other issues that you may see people with. Can you share some more about that and how you support people in all of those areas? It's just such a specific niche that I don't think people realize they can get support for.
Yeah, I see people all the time who have said they've lived with the symptoms for a very long time without even hearing about a diagnosis, or they've gotten a diagnosis and they haven't received any sort of idea of what to do about that diagnosis. So that's one thing I'm very passionate about, is making sure that people are educated about it and that there is something that they can do about it. So for people who don't know what TMD is, or a temporomandibular joint disorder is, it's when your jaw joints, sometimes there's pain, popping, clicking. Maybe you notice that your jaw can't open as wide. You may have ringing in your ears, ear pain, headaches, migraines, neck pain. It's a pretty vast bunch of symptoms. And to treat it, like I said it a little bit before, is that our jaw joints, they're joints just like every other joint in our body, and they're muscles, and just like every other muscles in our body. And what's so beautiful about the body is you can really reteach it. Your body can relearn and rewire, and it can strengthen itself with just the correct exercises and awareness. Reteaching the muscles of the face, the tongue, your neck and your posture, reteaching all of those muscles to coordinate together and work together in harmony versus maybe against each other, really goes a long way for treating people who have temporomandibular joint disorder.
And I love that what you said there about how you can retrain, the muscles in your body. And really that's so true for so much in health. There's so much healing that can happen that isn't necessarily part of the usual narrative that we hear. So just, like for people to know if they've been diagnosed with one of these types of conditions, and there's so much overlap between things too, I would imagine, in what you do. But but, it doesn't necessarily have to be a chronic issue. It can be addressed and kind of, so I'm curious, when you work with someone and do different exercises, say, does the person continue those exercises on their own, long-term, maintenance-wise? Is they get to a point where they don't need to necessarily do them as much? How does that, and I'm sure it's individualized, but.
It is individualized. Ideally, we get to a point where we've created a structure and retrained those muscles to work together naturally. So it's now a new habit, in that there's really not much that's needed to carry over. But that can take a length of time. So, sometimes people hear of physical therapy being just a couple of visits or a few weeks, maybe even a couple of months. Retraining your jaw and your tongue to work together and work well can take quite a bit longer bit of time, because there's a lot of pieces of the puzzle that need to be potentially addressed, right? So I usually follow people for about a year, because you swallow 1,000 times a day, if not more. And so when you swallow, your tongue functions in one way. You may notice, maybe you have some oral activity, like some lip activity that shouldn't be there. So you're really trying to coordinate all these muscles together. And it's not just getting them to coordinate, but then also carry on for every time you swallow water, every time you chew and eat your food, every time you're talking and swallowing, and then also making sure that carries over to when you're sleeping. So, there's a bunch of exercises we do to kind of build that coordination. And then it really is, we have to integrate all of those things into the daily life to make the most impact.
That sounds like it just makes so much sense. Why wouldn't we all do that for these different things we have going on? What are some of maybe the more common diagnoses that you might see people with?
For sure is TMD, so Temporomandibular Joint Disorder. I see a lot of people with chronic migraines and headaches. As I tell people who are apprehensive, they're like, oh, my neurologic or my oh my gosh, I just had a brain fart. But my neurologist said, oh, they're definitely neurological. I tell people there's always potentially a muscular component to these type of headaches or migraines. There can also be, I love working with naturopaths, because there can also be either a mineral or maybe a hormonal issue that's causing these headaches and migraines. So those were probably the top two, along with neck pain. Usually after a whiplash injury, I usually tend to see a lot of patients, they've already been through physical therapy and haven't had a lot of success, or maybe they don't feel their best. So I see a lot of patients after their second or third time going through physical therapy after either a whiplash injury or head trauma.
Yeah. Wow. Okay. And you must help them so much after all of that. I wanted to ask you a question and now it slipped away. All right, it'll come back. I know that you also, you work collaboratively with a lot of other healthcare providers, from primary care to even dentists, therapists, psychologists. And can you maybe just kind of touch on that for a moment? Because people may be wondering, how do all of these kind of fit together with physical therapy?
Yeah. So for TMD, especially for jaw pain, there's, people, we're always do you go to the dentist, or do you go to your doctor? And now I'm trying to say oh, you can also go to a physical therapist, but still all of those still need to communicate. And the biggest reason is that so a big part of your jaw is your tongue. So I explain it to my patients as you have a 3-legged stool, your 2 jaw joints, and your tongue. So if your tongue doesn't function or work well or operate the way it's supposed to, can you sit on that stool? can that stool function well? And the answer is no. Like you can't sit on a two-legged stool, right? So, I work muscularly. I work with the tongue. I work with the facial muscles and things. But if the tongue can't fit where it's supposed to fit, which is the roof of your mouth, your garage, I call it my garage. If your garage is too small for your car, then that's not for me, right? That's for the orthodontist or dentist, the dentist to maybe refer to the orthodontist to improve that garage or move that garage, right? Maybe the tongue has too many restrictions on the bottom of it, like a tongue tie. That's not a job for me, right? That's a job for a periodontist or a dentist who's trained in laser removal of that tissue. If the patient is having some really significant airway issues that is maybe causing their migraines or headaches, that could be for your ENT or oral surgeon, or, maybe even if there's nothing that looks wrong, that's for a neurologist, so there's many pieces of the puzzle, and everybody has their play, right, or their input. But if we work separately, we really don't create this cohesive treatment plan for a patient. They're kind of left feeling like, well, there's all these different parts. And I don't really like that. I think that, if we can all work together, the patient feels very well taken care of, and that just optimizes the healing process.
Yeah. That sounds so like just thorough and conscientious. And something that came back to me that I wanted to ask you before, kind of touch on, is just the idea that people we may not know how good we can feel because we may have been dealing with something for so long, like chronic headaches, migraines. I mean, migraines, you really know it, they can really wipe you out, depending on what, but even like jaw pain that may just seem kind of minor, if you've been dealing with that long term, you may not know how much better you can feel, because it can spread or spill into other things, like the neck tension, holding tension in other parts of your body, and then the physical influencing, the mental, emotional, in a sense too, where it's a perpetuating cycle. If you hold some stress in your jaw and you're clenching that jaw or grinding your teeth, and then that kind of feeds back into the stress cycle. So it's just big picture, kind of, we may not know how good we can feel unless we kind of address these little things that we're used to. So I think that's, something that I think about as a naturopathic doctor, but I think that kind of goes along with everything that you're sharing too, just helping people feel better.
Yeah, 1000%, because I hear it all the time, people kind of get a little nervous actually when they're talking to me. They're like, I've been having this for 20, 30 years. Like, do you really think that you can improve my symptoms? And my answer is yes, I do. But yeah, people just, they're apprehensive, or they just don't know how good they could feel, or just even, a common question I ask is, do you feel rested when you wake up in the morning?
Mm-hmm.
And people are like, oh, I guess I don't.
Mm-hmm.
You're like, are you supposed to feel rested when you wake up? And it's like, yeah, like, you're supposed to get 6 to 8, about 8 hours of sleep, 6 to 8 for an adult. And if you don't feel rested when you wake up after that, like, yeah,
Yeah. And I think that's empowering for people to hear that from you too, that like, yes, this can improve, you can feel better. Definitely. So I know you share a ton of information, resources, even videos online, on like social media, on your website. You're very generous with the information you share. Could you maybe share like maybe 1 or 2 tips that just like kind of quick in a sense, we don't have to spend a ton of time on them, but anything that comes to mind that might resonate with people as a more common support?
Let's see. Tips in like what sense? Like give me a little bit more direction, because I could go like a gazillion different
Okay.
ways. I feel
Yeah,
like.
kind of open-ended, I know. So maybe if someone is having like jaw pain for a long time, but it's not a huge issue, is there, maybe like a little massage action they could do, or like a repetitive, like some kind of habit that they could add into their routine that's kind of simple? I mean, anything at all. And I know, again, you share a ton, and we'll put your info for how people can see all of what you share. We'll put that below the video, but just anything kind of in that area.
Yeah. Okay. So one of the most, I think the more common things, and maybe you've seen this in your practice too, but is that since we've all gone through the pandemic and, wearing masks, that a lot of people tend to like clench their jaws, right? So one of the primary clenchers are your masseter muscle, which is like right here on your cheek, kind of further back. Right. And then your temporalis muscles. So you can massage those muscles just from the outside, find ththose tender points, maybe hold, do small little circles. Right. And then the same thing for your temporalis muscle. And it's actually a pretty big muscle. I have my skull. Right?
Awesome. Look at
Pretty
this.
big
Okay.
muscle. So make sure you go all the way to the back. Okay. And you can do the same thing. You can hold and circle. Okay. And then to kind of counter, I've touched on this a little bit before, but if your tongue is suctioned to the roof of your mouth, there's no way you can clench your teeth. So I tell people to really focus on suctioning their tongue nice and flat up to the roof of the mouth. And then you can even kind of like open and close while keeping that suction. So that exercise like looks like this. And what that does is it kind of stretches the jaw and then works on that suction and strengthening the tongue. And then if you just suction your tongue to the roof of your mouth, you can't really clench your teeth. So it's a way to just kind of relax those muscles.
I love that. That's so good. Yeah, suction your tongue to the roof of your mouth. That's so good. Mm-hmm. So good. And I certainly see a lot of people who clench their teeth, grind their teeth, that hold that tension there. That's such a good tip and so simple. Thank you. Thank you. Yeah. So how can people learn more about you and get in touch with you?
Yeah, so I do have an Instagram page, and there's a lot of really great videos, tips, stretches, even some of the things that I went over, like the massage that I just talked about on there. And my Instagram is healthy_heads_PT. And then my website I have a blog, I have a link to my YouTube channel. And there's some other freebies on there, some PDFs of some exercises, as well as maybe a checklist. Is your TMD really TMD, or is it something else? Is on there. And my website is reviveptct.com. So revive, like physical therapy, Connecticut.com.
Awesome. And I'll put those below the video in the notes so people can see them there too. Thank you so much, Dr. Liana. This has been wonderful and so informative. I think people are going to learn a lot. And hopefully everybody check out Dr. Liana's Instagram and her website. Really so much good information there. And probably if you don't have, head, neck, jaw, facial pain, probably somebody that you know and love is experiencing it. So it can be just a really great resource in general too. Thank you. Thank you so much for joining for tea time. This has been great.
It has. It's been wonderful. Thank you so much for having me.
Yeah, of course. All right. I'll talk with you soon.
Bye.